We're here to talk about meniscal tears. Now, the meniscus is a structure in the knee, and the point of the meniscus is to support the knee and provide a cushioning effect. This is a model of the knee, and you can see the meniscus, which is in blue. The meniscus has a shape like a half a moon, and that's why it's called a semilunar cartilage. Now, tearing the meniscus is common, and many people present to us with symptoms relating to pain in the knee. Often people are presenting to us without any history of injury at all, and they just find that one day the knee is uncomfortable, often on the inside of the knee, but sometimes also on other parts. The meniscus doesn't really have a blood supply, and if you look at this model, you can see that the meniscus is normally attached around the edge. In the middle of the meniscus, there's no attachment, and this section here, that is most of the middle of the meniscus, has no healing potential. If you have a tear in this cartilage, it can sometimes present with a catching feeling in the knee. It can also just present with pain at night time, and some people say that having one leg on the other is uncomfortable. Fortunately, surgical treatment for most meniscal tears is relatively straightforward. A simple arthroscopic procedure allows removal of that section of the meniscus that's troubling you. You will go home on the same day, and you'll come back and see us 3 or 4 days later. Whilst most people are particularly surprised by the rapidity of their recovery, you need not to be too aggressive with your return to sport. If, for instance, you're a keen runner, you should wait for 4 or 5 weeks before you return to a heavier training